Hello everyone, I am Dr. Deepa. Today we are here to learn about the differences between the true vocal cords and the false vocal cord. During the study of the topic larynx, we come across the two terms called as the vocal cords, one of which is the true vocal cords and the other is the false vocal cord. In this video, we will just focus on the differences between the two vocal cords here. During the study of the interior of the larynx, the mucous membrane lining the wall of the larynx makes up the folds, mucosal folds, which make up the vocal folds. This is the sagittal section, the diagrammatic view showing the interior of the laryngeal cavity, wherein we can just make out the entire cavity of the larynx, which is seen over here, which is seen to extend from the inlet of the larynx till the lower border of the cricoid cartilage, which is represented by the dotted line. This laryngeal cavity represents the fold over here, which makes up the vestibular fold. As we have already discussed in a previous video, the vestibular folds is the fold of the mucous membrane deep to which lies the ligament, that is the vestibular ligament, beneath which there is something called as the vocal fold, wherein the vocal ligament lies deep to it. In between the two folds, that is the vestibular fold above and the vocal fold below, lies the space which is called as the sinus of the larynx. This space represents the sinus of the larynx. The sinus seems to be projected on either side, as this part of the larynx is devoid of the membranes on either side, and the sinus seems to project upwards and backwards to reach the lamina of the thyroid cartilage over here, which is called as the saccule. The saccule is rich in the mucous glands. Coming back to the topic for today, the vestibular fold is called as the false vocal cord, whereas the vocal fold is called as the true vocal cords. The vestibular fold is called as the false vocal fold because these vocal folds, that is the vestibular fold, does not take part in the phonation, whereas the approximation and the vibration of the vocal fold mainly brings about the phonation. The vocal fold below contains the ligament beneath it, which is called as the vocal ligament, whereas the vestibular fold contains a ligament beneath it, which is called as the vestibular ligament. And this fold, that is the vestibular fold, is mainly the lower free border of the membrane, which is called as the quadrangular membrane. On the other hand, the vocal fold is the upper free border of the membrane called as the cricovocal membrane over here. So, the vocal fold is the part of the cricovocal membrane, whereas the vestibular fold is the part of the quadrangular membrane. So, this is what we can make out over here, and the space which is left present between the vestibular fold is called as the rima vestibuli, whereas the space present between the vocal fold is called as the rima glottitis. This is the superior view of the interior of the larynx, where this is the cavity of the larynx. So, anteriorly we can make out the thyroid cartilage here over here, the angle of the thyroid cartilage, the two lamina of the thyroid cartilage, the horns of the cartilage, superior horn. Now what is this? This is nothing but the part of the cricoid cartilage, that is the posterior lamina of the cricoid cartilage. What we see here is the anterior arch of the cricoid cartilage. Above the cricoid cartilage, along its posterior plane lies the paired cartilages, which are the arytenoid cartilages seen over here. Now what we see here from the superior view is this is the vocal fold containing the ligament, that is the whitish represents the vocal ligament, which is seen to extend from the inner surface of the thyroid angle till it reaches the vocal process of the arytenoid cartilage. Just lateral to the vocal ligament, we can make out the muscle adjacent to it, which is called as the vocalis muscle. This is important to be noted. The vocal fold contains ligament and the muscle as well, whereas the vestibular fold or the false vocal fold is devoid of any muscle deep to it. On either side of this vocalis muscle lies the other muscle, which is called as thyroarytenoid muscle. So the vocal fold is the fold of the mucous membrane which contains the vocal ligament and the vocalis muscle deep to it. And as we can observe here, the entire vocal fold, which is extending from anterior to posterior, is partly membranous in its anterior 3/5 and it is cartilaginous in its posterior 2/5. So in the anterior part, it is membranous as it is formed by the ligament and the muscle. In the posterior part, the fold is contributed by the vocal process of the arytenoid cartilage. So, the entire vocal fold has got the membranous portion as well as the cartilaginous portion, which is not true in case of the vestibular fold, which is completely membranous. Next, we will just look on to the differences between the comparison between the true and the false vocal cord. The true vocal cord are the vocal cords itself, hence called as the vocal cord, whereas the false vocal cord, which is devoid of its function, they are called as the vestibular cords. The true vocal cord bring about the phonation, whereas phonation is not the function of the vestibular fold. Deep to the true vocal cord lies the vocal ligament, whereas the vestibular fold contains the vestibular ligament. As I have already mentioned, vocalis is the muscle present along with the vocal ligament, which is the content of the vocal fold, whereas there is no muscle seen in case of the vestibular fold. Appearance wise, the vocal cord are pearly white in color, whereas the vestibular fold is pinkish in color. The vocal folds, they are lined by, it is lined by the stratified squamous non-keratinized epithelium, as they are more subjected to the friction and vibration, whereas the vestibular fold is lined by the normal ciliated columnar epithelium. The vocal fold is mainly formed by the membrane from below, that is the cricovocal membrane, whereas on the other hand, the vestibular fold is formed by the quadrate membrane from above. The other important difference is the presence of the submucosa. Yes, the submucosal coat is absent in case of the true vocal cords, whereas it is present in case of the false vocal cord. The taste buds are not seen or absent in case of the true vocal cord. The vestibular fold represents few taste buds on its epithelial surface. Next, the direction of the vocal fold. The vocal fold is directed upwards and medially, whereas the vestibular fold are directed downwards and medially. And I have just now mentioned the vocal fold are partly membranous and it is partly cartilaginous in nature, whereas the vestibular, all the false vocal cords is completely membranous as it is made up of the vestibular ligament covered by the mucosal fold. And lastly, of course, there is a difference in the nerve supply, the blood supply, the lymphatic drainage of the two cords. The blood supply of the vocal cord is mainly by the inferior laryngeal artery, which is the branch of the inferior thyroid artery, whereas the blood supply of the vestibular fold or the false vocal cord is mainly by the superior laryngeal artery, which is the branch of the superior thyroid artery. When we talk about the nerve supply, the sensory nerve supply of the mucous membrane above the vocal cord, that is the false vocal cord, is by the internal laryngeal nerve, whereas the vocal fold is supplied by the recurrent laryngeal nerve. Moving on to the lymphatic drainage above the vocal fold, the lymphatic drainage is by the prelaryngeal and the jugulodigastric group of lymph node. When we talk about the lymphatic drainage beneath the vocal fold, it is mainly taken up by the tracheal, that is the pretracheal and the paratracheal group of lymph node. So these are certain differences between the vocal folds and the vestibular fold, which is or else called as the true vocal cords and the false vocal cords. Thank you.